Welcome to the Wild Physio Podcast with your host, Andrew Wild. Today I have Ryan Hebron on, and Ryan is an exercise physiologist who balances his work with semi-professional AFL with the GWS Giants. He's also currently teaching exercise physiology and exercise and sports science students at the University of Sydney. He combines his learnings from both the clinical research and high-performance environments to help a range of populations. He's particularly passionate about working with chronic health conditions such as mental health, cardiovascular disease, obesity, and frailty, as well as helping the general population to achieve their health and fitness goals. A big welcome to Ryan Hebron.
Thanks for having me, Wildy.
Pleasure, mate. This has been in the pipeline for months, so we finally got here.
Yeah. Yep.
Mate, first things first, what is an EP? Because I think a lot of the population don't know what an exercise physiologist is. How do you go about getting there, and what do you do on a day-to-day basis?
Obviously exercise physiology has a lot of crossover with professions like personal training or even physio. I guess our specialty is using exercise as medicine to treat certain health conditions and injuries. You have to do either an undergrad 4-year degree or masters in exercise physiology. Guess that's exercise physiology.
Yep.
Day to day, it would, I guess like if you just walked through a gym, you might see a PT working with a client and then see an exercise physiologist, and the only difference might be like the EP is wearing pants. Like you're both delivering exercise, helping people achieve health related goals, fitness related goals, body comp goals. I guess the exercise physiologist has got that applied science background, knows how to deliver an exact dose of exercise to manage health conditions like diabetes or treat frailty and cardiovascular disease. Probably more of an understanding around things like mental health and I guess like the nuances in the management of that, and using certain tools to actually measure progress. A lot of conditions that I guess like a PT might be able to treat and do a really good job with, but I guess we're just more qualified in that sense. So we've put in the work at uni, really understanding the fundamentals and the science and the literature.
So no doubt you would work with more people that have chronic health conditions versus someone like a PT. A PT is probably working with more general pop. Obviously, they can work with chronic health conditions if they wish, or if the person has been cleared to do so, but you definitely would work with more of the chronic health.
Yeah, definitely. We, like a lot of the referral pathways are from allied health professionals and GPs. So there are certain conditions where, like you definitely indicated, to see someone with our skill set. It's definitely the bulk of my books, just those chronic conditions.
Yeah, and in
But in
regards
saying
to
that, you can still you still have the ability to see like if the person in front of you wants personal training, like you can deliver that, and they want to see an EP for personal training. That's totally fine.
Yeah, and when it comes to the difference between an exercise physiologist and a physiotherapist, what are the clear distinctions between the two?
Well, I guess EP, like very much like exercise modalities, no hands-on treatment or passive treatment. We don't really get into any of that. No diagnosis, whereas obviously physio do that. And I guess like, yeah, I guess the gray area is like we can see people for acute treatment, but that's normally done with a physio, and then we're more chronic um, time frame, that longer term treatment. But yeah, I guess a lot of gray area with that, as you know.
Yeah. So someone could see an exercise physiologist if they'd say done their ACL, and
Yeah,
then
definitely.
they present to an exercise physiologist, and they've had the injury was on the weekend. They heard a pop, it swelled, etc., and then they present to you, and then you say, look, you need to go to a sports doc or a physio to then go for further imaging, etc., to confirm the ACL rupture. Would that be something that you would see sometimes?
Yeah, definitely. Yep.
Yep. Yep. And when it comes to this exercise and sports science degree, I've got so many of these young footballers that are coming and chatting to me at the moment about what they're going to do after they finish school. So the problem that they have if they want to do physio, often the ATAR is so high, you need to get about 95 plus at most universities to get in. And a lot of them are asking me, should I go down that route of doing exercise sports science? Should I do exercise physiology? What should I do to then finally get into physio? Or is there an alternative path where I could do exercise sports science or exercise physiology and feel just as rewarded and you're doing a great job with all these type of populations? How would you go about it? And what does the exercise sports science degree get you? And
Um,
where does it get you?
yeah. So I guess firstly, like I can comment on this because um, I know exactly what subjects that I did are exercise sports science curriculum versus EP. And I've had mates that have gone from sports science to physio. Um, and I guess being at Sydney Uni, teaching a lot of the sports science third years, yeah, it's been really interesting having that discussion. I think it's a really good degree, sports science, but yeah, they almost need a whole subject just to have that career, that career mentor that's available at the uni to just sit and do some really good one-on-one work with each of them, because I think there's a lot of them that come to the end of it, and I think they want something more than being a personal trainer. Um, they might have that sports goal, which is quite a competitive field. And from my experience, a lot of people that go into sport, it's not quite meeting exactly what needs and experience that they wanted in a job. Um, so I guess like for that person that you're speaking to um, in high school, really tough time to make a decision on what you want to do. Just I really would encourage them to think about like where can they see themselves working. Um, you probably want to talk to as many people in those industries and fields as you can. Um, Quite hard to know if you want to work in sport if you've never seen and spoken to someone who works in sport. Um, Hard to know if you want to do exercise physiology if you've never seen an exercise physiologist. Um, Probably a lot of them have seen a physio because most sports teams have a physio. Um, when I ask the students like, okay, what are you doing next year? There are a lot of I'm not sure what to do. And I'm like, okay, yeah, like what do you like delivering exercise? Like, can you see yourself doing that? And there often is that like, yeah, but I don't think it's enough for me. I'm like, okay, what are you leaning towards? Physio. Okay, why do you want to do physio? Like um, yeah, like, what's the difference between physio and working, I guess, as a PT? Where's that sort of gap that would make you happy in that job? And they can't really put a put a finger on what that is. Um, so, I think it's really challenging decision. But I think we need a little bit more guidance for them, and probably more experience in different environments to work out what they want to do, because they've got like such good knowledge, really good skill set, and then they come to the end of that 3 years and often they don't know what to do with it. Another issue is like, they've done 3 years of sports science and they can't even see a client that next year without doing a Cert 4. So
Yeah.
I know that there's a bit of work being done to do a bit more placement hours so that they can tick off that accreditation to meet that.
Well, it seems
But yeah, it's
crazy
a
to
tough
go for
call.
it seems crazy to go to uni for that amount of time and then have to still go off and do that Cert 4 when they're overqualified comparatively to a PT that's done a Cert 3, 4.
Yeah, it's wild.
Yeah. And
Um,
that just shocks me, the fact that that is even the case. And I have had this discussion with multiple people that have done exercise sports science, and they felt like they were disillusioned at the end of the degree. And, they've got this massive HEX debt and they could have just probably started working 3 years ago as a PT. That be if they didn't get into physio or whatever they wanted to do after the degree. Not saying that you have to do anything after an exercise and sports science degree, but a lot of them do want to, because there is that case and that scenario where people don't get into the degree they want to get into based off the marks, etc., that they get through their first degree. But I agree with you that it's got weight, the degree, because much like the US system, where you do an undergrad and then you do a postgraduate in something, and then finally that's the path you go down. It's hard to know when you're 17, 18 what the hell to do. So at
yeah,
least that sort of 3-year degree, much like sort of an arts degree or something like that, it's kind of giving you that base of, all right, I've got this knowledge. Yes, maybe I'm going to go down that physio path, or I'm going to go do a 180 and go and do something completely different. But
yeah.
it's a
I
tricky
think
one.
I think for those, I guess like it's the sporting environment that you're speaking to, like those 18-year-olds.
Yeah.
It's at footy, is it? Yeah. So
Yeah.
I think it's a good choice for them because it's something they're passionate about and they've got an edge over other people because they've interacted and engaged with, quite quality training. Like I assume they're doing strength and conditioning
Yeah.
work, and just general periodization and experiencing injuries and stuff like that. So it suits them to do that. What they'll get out of it, even if they don't go into an exercise field for a job, like they're learning how to engage with literature and evidence. They're understanding science, which helps you think. Like there's lots of mentoring and improvement in your critical thinking. I don't think you can waste an applied science degree.
Yeah.
And then, I do, in terms of the exercise, like having seen them go from like day one of placement where a lot of them are delivering exercise for the first time to, 12 weeks in, like the gap between their skills is so huge, and they're getting like such quality mentoring from the uni. I think it's a good degree, and it probably doesn't get the recognition it deserves from a lot of people.
Yeah. Which is,
Yeah,
and with my practice as a physio, so the longer I've been in this game, the more and more I'm working as more of the exercise physiologist. So in terms of my hands-on treatment, like it's not non-existent, but I don't do that much hands-on treatment. Per week I might do, I don't know, max an hour of hands-on treatment for the week. Most of it is exercise based in the gym, hence why I've got a big gym in the clinic. So the longer I go through my career, the less I'm using my hands and the more I'm using exercise to help people. The one thing that we can do as physios that exercise physiologists can't is the diagnostic side of things. However, if you are an exercise physiologist, you can obviously use your contacts in the physio world combined with sports doctors, etc., to probably achieve a similar result, because they will be able to do the diagnosis, all that sort of stuff, and then they're handing them back to you to then help them through their rehab and their progression long term. So it is a little bit of I feel like it's this hybrid mentality that we've talked about on the Hybrid Therapist podcast. I feel like physios and chiros and everything, we're starting to see that shift where they're starting to practice more and more with the active modalities, and there's less passive, which is great. Now, do we need to eventually get to the point where exercise physiology, physio, chiro, we all merge into one degree, and it's like a rehab consultant or a rehab professional or a exercise professional, and then rather than having all of these different types of sort of the same thing in a way?
Yeah, it would definitely help solve that issue of like working in silos. And I guess, yeah, one client saying sometimes the physio, chiro, and EP like all at once, and you're like,
Yeah,
okay,
exactly.
what's going on here? Like,
Yeah.
um, yeah, like there should, like all three of those professions should be using the same recommendations and evidence,
Yes.
um,
Agreed.
which is, yeah, something I found interesting and a challenge.
Yeah. And I've talked on the Athletes Authority, it was actually my podcast, but with the Athletes Authority guys, about exercise physiologists in professional sport and how it's quite rare to see an exercise physiologist in pro sport. And that was because Lockie Wilmot was saying that often it's a physio that's already ingrained in the in the team, in say at the Sydney Swans, and then eventually they get to the point where that physio then becomes the head of performance, or they transition more into the strength and conditioning side of things, or you have the strength and conditioning coaches start to transition into the high performance side of things, and very rarely does an exercise physiologist even get a look in. So is that something that you would want to do going forwards personally? And how would an exercise physiologist get a job in a professional sporting team, or because obviously you've got the background with the GWS Giants? How would they go about it?
Hmm. I guess firstly, like there's a couple of factors. Like if you've chosen exercise physiology, a lot of people have probably picked that because they want to work with chronic health. Like that
Yeah.
is one of the, yeah, it's like otherwise they might choose sports science into like high performance or something like that. Um, yeah, I'm like I've grown up in like, you know, high performance environments like the Swans Academy, and the Swans and then the Giants. Like I love the environment. Um, I probably am more inclined to the like clinical side of things. Not saying that it won't play a role in my career, but it is tough to get a look in. It Yeah, it's a very competitive environment as is. Um, it's going to be saturated with a lot more sports scientists than EPs. Um, and I think there's also that like, yeah, a lot of those initial jobs are internships, which you don't do as an EP, I don't think. So yeah, it's going to be really tough for an EP to get a job on LinkedIn from
Yeah, yeah.
like, oh, we've got a full-time role for you at the Giants.
I think they could obviously apply, but the only way that you're probably going to get a
Yeah,
look in at the professional level is if you had a master's, and that master's would be probably in high performance sport potentially, or something like
yeah,
that. But as you said, you make a good point. A lot of students that jump into exercise physiology at university probably want to work with chronic health conditions rather than go down the sport route.
mm,
The thing is with exercise physiology, though, comparatively to the exercise sports science, at least there's an award. there is a pay that you will get when you come out. With the exercise sports science, there's a big question mark on, all right, how am I going to fund my life going forwards? What am I going to do?
Yeah.
Am I going to work as a PT? Am I going to go back to uni and have even more HECS debt? What am I going to do going forwards? Or am I going to go off and do a PhD in something sports science? Am I going to do a master's, the Edith Cowan Masters in Strength and Conditioning or something like that? It's a tricky question, and it's a tricky one to figure out, all right, where do I go? And you're not going to know until you start to work in the industry as well. Because personally, for me, I always wanted to do something in sport, but I started working at the Swans Academy as the head physio there, and the transition was to stay there to a point where I then was the head, or one of the physios at the Swans in the senior club. And I started doing more and more in this professional sporting world, and I actually didn't like it, which is completely the opposite of what I would think, of what I thought. I didn't like it because I felt like my job as a physio was quite small, because there's the sports doc, then there's the physio, you've got the strength and conditioning guys as well, the head of high performance. So your role is cut, and you don't have as much of a role because you offload the guys to strength and conditioning, when I wanted to do the strength and conditioning side of things because I really liked that stuff and I was a strength and conditioning coach. So I just felt like I got squashed a little bit at that professional level, and it kind of frustrated me. So the other thing is there's a massive time factor, and you're not really working with that many people as well, because at a club you might have 40 to 50 players in the club, so not every single one of them's going to have an injury. So I didn't really like it that much, and I much prefer to work with general pop, and I really enjoy working at Review and doing work with the adolescent kids down there. I find that rewarding. But much like you're saying that, you work in more of your chronic health conditions or with chronic health conditions, but then you play at the professional level, but you've gone a completely different route than what a lot of people would have thought you would have gone down.
Yeah, definitely.
Do you find it more rewarding?
Yeah, like you said, look, I'm sure like working with athletes would be super rewarding. I think for me, similar to what you said, like I get a sense sometimes from speaking to people like yourself, like probably too many cooks in the kitchen.
Yeah, 100%.
I think as a young fella, like I'm keen to have someone where I can deliver an intervention, see how it responds, get good feedback. All right, confident with this pathology or injury, in treating it a little bit more confident at least. Whereas, in that environment, it's like very complex. Okay, they're getting so many treatments from everyone. They're playing footy. I don't know how that's interacting with my program. All right, this guy got injured. Like, what were the causes of that? Like, was it the 40K running week? Was it the 150 tackles they experienced in the last month? Like, were they out till 6 a.m.? Who knows? So yeah, I think nice and simple in my job. Simpler at least. I would never say simple. Yeah. And then I definitely find it rewarding, like working with, say, like someone who's older and frail, and just putting them through a pretty basic strength program, and then 12 weeks later they're like, I feel 5 years younger, and I've got less pain. You're like, you can't beat that. That to me is better than beating Collingwood by 2 points.
Yeah. I agree, because I think something
priceless.
like that. Yeah, I agree. It's priceless because it changes their life more than something with sport. Like, obviously them getting back on the park and playing a game of football is great, and it makes them happier. Their mental health's probably better. But I think working with an older population or people that have chronic health conditions, you can change their life a little bit more, their day-to-day function. Even I've had older clients that, struggle to get up and down off the toilet. And then you just, as you said, give them a basic strength and conditioning program, get them a little stronger, and then they can just get off the toilet a little bit easier. And that sounds so basic to a lot of young people, but just getting off the toilet and getting onto the toilet and being able to do it yourself, or get down onto a chair without having to think, oh, how am I going to get back up? Like
Yeah.
that is going to change someone's life exponentially. Their life is going to feel a lot freer.
Yeah. Yeah, definitely.
Now, when it comes to professional development for exercise physiologists, how do we go about it? How do we bridge that gap between learning things within your university degree, being a bookworm, and then transitioning into clinical practice? Because this is a massive issue in the physio world. There isn't enough hands-on in the trenches clinical work probably prior to finishing. It's getting better. And there's not enough strength and conditioning as well, as we've discussed many times on this podcast and other podcasts I've been on. How do exercise physiologists bridge that gap?
Mm. Yeah. So I guess like firstly, I think 4 years degree, like that sounds like a lot, but it's definitely not enough to be fully equipped with the knowledge and I guess skill set that you need to be the practitioner that you definitely want to be. Um, and they have to fit in things that you'll never use, such as like I don't see myself using ECGs in a hospital. Like that's just not something I see myself doing. Yet I spent 6 weeks learning how all those squiggly lines reflect certain pathologies. Definitely could have been, you know, playing with barbells during that time. Um, so yeah, that the thing that unis do super well is they give you um, certain skills that you can then use for your ongoing professional development um, for life. So they make you literate in analyzing literature and finding answers. Um, they mentor you on how to solve problems and critical thinking. They give you certain examples throughout your course where um, you know that's just one example of many, which will all look super different. But you now know how to find a really good answer and solution. Um, what they what gap you'll have is like you haven't seen all the conditions, obviously. So um, I think when you come out, there's out of uni and you start seeing clients, you just think, oh God, like I need to prepare myself for everything that could walk in the door, which is totally unrealistic. Like there's so many health conditions and injuries, and I guess like life scenarios where you're just not going to have all the knowledge in your head going into that next appointment. But that's all right because you've got the skills to find them. I think what some of my biggest gaps were um, that it wasn't so much around the health condition knowledge. It was definitely around psychology um, and I guess like changing behavior. We definitely learn a lot of that at uni, but it's just so complex. Like you almost need to strive to be like a clinical psychologist to create behavior change a lot of the time. Um, it was also communication, which is linked to psychology. Um, there's a lot of things that as I've discovered, like you'll say one thing and like how that is interpreted and felt by the person in front of you isn't the way you want it to be perceived. So you've got to build a lot of self-awareness on, yeah, your language with certain clients, which is just such a steep learning curve. Um, you need to just spend time in the gym yourself, training yourself. Um, even my like history with footy, like all the training I did, I don't think it was enough. Like I'm in the gym now, like doing things that my clients are doing. Like I'm seeing something that Wildy's doing and I'm doing it myself to see how it feels, how my body responds. And then I'm so much better at teaching that and knowing where it would fit with certain clients. So definitely got to be training yourself, and I guess like doing not your usual routine, like experimenting with things that you're getting a client to do. What else? Any any questions, Wildy?
No, I agree. I
I
think
guess
that
it's a long list,
that's
isn't it?
it's vital to be training yourself. It's communication and the psychology side of things is imperative. You get better at communication the more you practice, like anything. The psychological side of things, I think you need to do a lot of research. You naturally get better, have a mentor that may help you. Um, there are other things you can do. There's courses. A lot of the clinical sort of courses in physio and exercise physiology I'm not convinced they're very good. Um, there's a lot of wishy-washy courses out there, especially in the physio world, when it comes to hands-on treatment, which teach you effectively nothing. Um, Now, physios, we've discussed it multiple times on the podcast, the strength and conditioning course to upskill in that. But as an exercise physiologist, I think you hit the nail on the head. Yeah, in the gym, psychology, and then the communication side of things, I think is probably the best thing you could do in the first year out is nail your communication. Anything
Yeah, I
else to
think
add?
the communication thing, um, yeah, it's if I look at a cohort of students, like that is make or break. Um, so can you make the person in front of you feel comfortable? Um, and there's so many people, especially if you're in a gym setting, like they walk in, they're super intimidated. Like, how do you break the ice, build rapport, make them feel comfortable? Um, and then, yeah, I guess like there's different personalities in front of you. Sometimes you'll have someone you've got Wildy sitting in front of you, like very dominant and direct. Like you've got to talk to him differently to like very anxious, like, Margaret, who's first time in the gym. Um, you'll have people that just love numbers.
Yeah,
You've got to be like super on point with like, yeah, probably getting a little bit more sciencey and delivering the quantitative stuff. Um, and then yeah, like if you get into even like the mental health of healthy pop, if that makes sense, like not
yeah,
just anxiety, depression, but just like yeah, the mental health of um, people who are considered like healthy. Um, just like the worry, like the fear avoidance, like how do you reassure people? Like that reassurance is like one of the biggest skills like any of the allied health professionals can give. Um, and they're often like one of the hardest things is like reassuring them after they've been told something different from someone else in their healthcare plan, not pointing at like any professions in particular, but I've had examples from surgeons or doctors who, yeah, by and large do an awesome job with their clients in a very tough health system. But yeah, undoing that is so hard. Like you've got to be really on point with your communication and your authority. Like it's really hard to communicate authority when they've seen a surgeon and a doctor who they've got on a pedestal, and then like PT or EP like definitely don't have the respect that they do. So um, yeah, I think it's just an array of things that um, all come back to like build the way you think and communicate. Acknowledge that like you've got a long way to go with that. It's a very long process, and you're not expected to be perfect in those first few years. But yeah, there's lots of mentors, books, resources that you can use. Like everyone's gone through the same challenges as you, and they've written about it and spoken about it. Um, so there's heaps of ways you can improve all those things, and just time in the game, I think will help. Time in the game with good self-reflection, you'll be well on the way.
yeah. I completely agree. And I think in any allied health, you have to be a people person. And even if you're not and you're more of an introvert, you're probably going to have to become a little bit more extroverted when you are with clients, because as you said, you're going to be dealing with a lot of different personalities. This is my one gripe with the physiotherapy profession, is the fact that the ATAR is so high. It often attracts the wrong type of people. So you're often attracting very intelligent, book smart people that maybe not as, say, extroverted as they probably should be if they wanted to work in more of the private practice musculoskeletal sports setting. Now, a lot of them get to the point where they get disillusioned with the degree, the profession. They get to the point where they go off and do medicine, which is fine, or they just leave. The retention rate, attrition rate at physio is pretty ordinary with any allied health. So I think it is a problem, the fact that it's the demands there that they need to push the ATAR up so high. Just because someone gets 98, they think, oh, they could do anything, but then they like sport and they're like, oh, maybe I should do physio because I like sport. You probably shouldn't be doing physio or exercise physiology or whatever just because you like the gym or you like sport. There's more to it than that. You need to be in it for the right reasons, and that is helping people. You like communicating all day, because literally it is communicating and talking to people all day. You can deal with a lot of different personalities, or you want to get to that point. Because I think that is probably one of the hardest things about any allied health or any health profession, is the fact that it drains you a fair bit dealing with people all day, different personalities. And we've discussed it on the Hybrid Therapist podcast. It's like people are kind of like emotional vampires, like they're sucking the life out of you slowly. Towards the end of the day, you're pretty drained because people are just offloading their problems. Is it similar in the EP world in regards to, do you think it's attracting the wrong type of people, or do you think they're doing a good job with that?
Well, I guess if we think of that young person, like it's a tough decision to make. Like, I don't know how you make a good decision at that age without working a couple of jobs. It's it is a bit of a gamble. And then so that I don't know how to help those 18-year-olds make a decision. Like, that's a really tough one. But I guess, like, let's look at that sports science third year again, making a decision, because they've experienced whether they like the industry at least and can make a bit more of an informed decision. I think people have to be careful of making a career decision based on, like, at the root cause of that decision, you're just trying to get more respect, as opposed to doing it because you're passionate about what that service delivers.
Yes.
So for me, I'm really passionate about EP because I really am passionate about exercise as medicine and, like, just improving people's lives with that modality. But I can see that some people are going into certain fields because it's a high ATAR in physio, as opposed to whatever the alternatives are. They're going into medicine because they'll get respect from that, not because they want to deliver medicine or do whatever. There's definitely a lot of that thinking in some of the conversations I'm having, and we all do it. Like, we all want love and respect, but you've really got to put yourself in that room as a physio, as an EP, as a doctor. Like, can you see yourself doing that and enjoying it, and living like a rewarding life, because it's such a massive chunk of your life, like at work. Yeah, you got to really think deeply about these things. Try not to get influenced by, really scarce degrees, that you'll be like, I accomplished something because it's really hard.
You got to do a lot of work experience. I agree with that, because I think a lot of people go into a degree and they've probably got a warped sense of what they're going to do when they do come out. They become a lawyer because they think they should, or they become a physio and they've had only exposure to physio on the side of a football game. but they don't
Mm,
realize that there's different areas of physio, the neurological, the cardiopulmonary, blah, blah, blah.
yeah.
There's so many things within a profession that you can do, but often people are going in blinkered into the degree. They start it and then they're 2 or 3 years in and they're like, oh shit, I'm not sure whether I like this. And you're like, well, you probably should have done a little bit more research and time making a decision. And the only way to probably make a decision is spend more time around people that work in the profession, whether that be medicine or physio, EP, lawyers, blah, 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 you know?
Yeah, I went through a process in my degree. I'm like, oh, I really want to do like cardiac rehab. Um, you're in a hospital, like super cool on the LinkedIn. And you're with like a clinical pop, and that's an awesome job. But it's not for me. I really couldn't see myself in a gym, and when I really uncovered like why, I think it was like it probably came back to that. Like I was wanting respect, and I definitely would get less working in a gym setting than if I'm like in a hospital doing cardiac rehab. But it suits my skill set. I get to help far more people than just my clients. Like I'm engaged in an environment where I can just add help, support people who are in the gym. And I've got heaps more equipment than a hospital in terms of gym equipment. So it's perfect for me. But like I almost made that decision for a reason that didn't serve me.
Yeah. Mate, it's been a great chat. First podcast, how did you go?
Yeah. Oh, I feel like it went all right. It's always good chatting to you. A good mentor of mine. Lucky to have met you at the Swans Academy, and then yeah, doing a bit of editing with the Your Body Bible.
Doing a great job too. Plenty of great recommendations, and yeah, he's flying along.
Yeah, no, thanks for having me on. Really appreciate it.
No, my pleasure, Ryan. It's been great. We have to do a 2.0. We're going to chat about exercise across the lifespan, frailty, aging, etc., etc. So the 2.0 will be out in the next few months, no doubt. So good luck with all the football and good luck with work going forward in the next few months before we chat again.
Thank you. All right, we'll talk soon.
How do people find you just before we finish up? If they wanted to
Ooh,
get in touch with you, do you have a Instagram? Do you have email, something like that? People can get in touch with you, even if they're 18, 19, they've just finished their degree or something, and they're curious how to go about starting their career.
yeah. I mean, you can find me on LinkedIn, or I think my Instagram handle's Ryan.Hebron. So Hebron, last name. Yeah, more than happy to talk to people. Like I've been through the challenges that you're probably experiencing. And yeah, like happy to answer any questions.
Awesome. If you can't find his details, reach out to me and I'll put you in touch. And as usual, stay strong.